Our next presenter is going to give us a brief overview of the State Health Improvement Plan. So I'd like to welcome Julia Fitz-Gibby from the Florida Department of Health. And Julia, you need to unmute your microphone when you're going to get ready to speak.
Thank you for reminding me. So good morning. I am Julia Fitz-Gibby, and I am the Chief of the Bureau of Community Health Assessment here at the Florida Department of Health in Tallahassee, Florida. And it is my pleasure to provide an overview of the 2022-2026 State Health Improvement Plan, affectionately known as the SHIP, to you today, as this plan also aims to advance the well-being of Floridians through statewide partnerships and collaboration. The State Health Improvement Plan, or the SHIP, is a roadmap to guide the development and enhancement of structures and systems to support optimal health and well-being for the millions of residents and visitors to the great state of Florida. Its overall purpose is to provide a strategic direction for health in the state for the next 5 years. It provides a platform to raise awareness of shared priorities and celebrated shared success, and is an instrument to help us increase efficiency, effectiveness, and performance of Florida's public health system as a whole. The 2022-2026 SHIP was launched in January of this year. Next, let's briefly review the State Health Improvement Planning process. Over the last year, we have solidified the 7 health priorities and established priority area work groups, or PAWs, who have worked diligently to develop goals and objectives for their respective priority areas. On March 31st, the SHIP Steering Committee met to solidify the objectives for inclusion in the plan. Now that the objectives have been selected, the implementation phase of the 2022-2026 SHIP will begin on July 1st, 2022. So here's a depiction of the organizational structure for the development of the SHIP. All 3 groups shown here, the SHIP Steering Committee, the State Health Assessment Advisory Group, and priority area work groups, are comprised of statewide partners from diverse sectors that have a vested interest in improving the health of Floridians. The steering committee's role is to provide leadership, oversight, and guidance for the entire state health improvement planning process from start to finish and throughout the 5-year duration of the plan. They also establish priorities based on the recommendations of the State Health Assessment Advisory Group and approve the goals and objectives proposed by the priority area work groups. The State Health Assessment Advisory Group is responsible for overseeing and participating in the development of the state health assessment and recommending priorities for the SHIP. Once the priorities are solidified, the priority area work groups are initiated. The priority area work groups, or the PAWs, are the operational arm of the SHIP. Membership in the PAWs is voluntary, and the work groups consist of individuals from various sectors and backgrounds and can include anyone with a vested interest in improving health in our state. The members serve throughout the duration of the SHIP, and the PAWs are open to additional interested members at any time. In order to realize meaningful impact on the identified priorities, it is vital to have strong, robust PAWs comprised of subject matter experts from organizations across the state. This is a state health improvement plan that requires cross-sector interagency collaboration to achieve the identified goals and objectives from each SHIP priority area. Based on the SHIP Steering Committee discussions around the state health assessment findings, current efforts, and priorities, the 2022-2026 SHIP includes the following 7 priority areas: Alzheimer's disease and related dementias, chronic diseases and conditions, injury, safety, and violence, maternal and child health, mental well-being and substance abuse prevention, social and economic conditions impacting health, and transmissible and emerging diseases. Usually, I would take a closer look at all 7 priority areas and discuss each goal. However, in the essence of time, I would like to highlight a few priorities that may be of interest to the Florida Asthma Coalition membership for future participation. But please keep in mind that you can join any of the 7 priority area work groups. The Chronic Diseases and Condition Pod has outlined 7 goals that are shown here. One in particular I wanted to bring attention to is goal number 5, which is improve respiratory health. But the other goals they have listed under chronic diseases and condition include reducing new cases of cancer and cancer-related illness, disability, and death, improving cardiovascular health, improving respiratory health with objectives pertaining to topics such as quit attempts for smokers, childhood asthma emergency department visit reduction, and home radon measurement, health promotion through nutrition, physical activity, and supportive lifestyle behaviors, and increasing access to and use of oral health care with a focus on untreated tooth decay in children, fluoridated water access, adult dental visits, and preventable emergency room visits due to dental conditions. The second priority I would like to highlight is maternal and child health. And they have 4 goals, with goal 1 being one that I wanted to bring special attention to, which is increase access to quality primary, preventative, and subspecialty care for infants, children, and adolescents. This deals with the use of medical homes for children with special healthcare needs, the availability of treatment and counseling, and preventive dental care and developmental screenings. We also have goal number 2, which is reduce infant morbidity and mortality with a particular focus on very low birth weight infants, average length of stay for infants with neonatal abstinence syndrome, congenital syphilis rates, and the Black infant mortality rate. And we also have a focus on reducing maternal morbidity and mortality pertaining to topics such as Black pregnancy-related mortality rate and postpartum care visits for mothers with Medicaid. And goal 4, which is improve preconception and interconception health by addressing oral health. The next priority I want to bring attention to is the social and economic conditions impacting health pod. And they are working to expand access to high quality education opportunities with a particular focus on reducing the high school graduation rate gap between students with physical and/or developmental disabilities and students without physical and/or developmental disabilities. They're working to improve access to high quality healthcare services, support communities by increasing the prevalence of trail towns and livable communities and decreasing the percentage of food insecurity, and enhance opportunities to foster economic vitality and resilience with objectives related to housing costs and weatherization assistance. So you may say, how can the Florida Asthma Coalition members be active participants in the SHIP? How does your organization fit in? Well, the success of the SHIP is directly tied to partner initiatives that support the priority area goals and objectives. We would love for coalition members and their organizations to be involved on the ground floor. There is an opportunity for coalition members to be working across many or perhaps all of the priority areas through their participation on one or more of any of the pods. Within your organizations and across the state, you can be a champion for the State Health Improvement Plan. Become an advocate by participating on one or more of the pods, aligning your organization's strategic priorities with the SHIP priority areas, or informing others about the SHIP and its purpose. If you would like more information on the State Health Improvement Plan, please feel free to visit our website at floridaship.org. There you will find a plethora of resources, including pod information, meeting materials, and SHIP reports. You can also find reports for the old SHIP and for the new. If you or any of your colleagues are interested in contributing on any of the pods, please reach out to the health improvement planning team here at the Florida Department of Health at hsp.healthimprovementplanning@floridahealth.gov, or go to floridaship.org and fill out the contact form right there on the website under the Contact Us tab. I have provided my contact information as well as the contact information for my health improvement planning team here at the Florida Department of Health. If you have any questions, comments, or feedback, please do not hesitate to contact us. With that, I would like to thank you for your time and look forward to working with each of you to advance the well-being of Floridians.
Terrific. Thank you very much. We do have a couple of minutes before we're going to get started with our next presenter. So if anybody would like to ask a question in the event chat, I can read it out and we can take a moment to answer that. I'm going to flip back to my event tab to see what we've got. All right, I'm seeing some thanks for Julia. It was a terrific presentation.